Hello and welcome to another episode of Hussah Medical Talk at Dasman Diabetes Institute. I'm Dr. Mohammed Al-Mahtab. In today's episode, we will be highlighting for you all the information you need to know about type 1 diabetes. Also, the remarkable efforts of Dasman Diabetes Institute in supporting patients with type 1 diabetes mellitus. This institute, established as a leading center for diabetes care and research, the institute is dedicated to improving the lives of individuals with type 1 diabetes through comprehensive healthcare services, cutting-edge researches, and innovative educational programs by providing personalized treatment plans, advanced technology support, and ongoing community outreach. So, dear viewers, stay tuned with us to watch this episode. Welcome back. In today's episode, we are honored to have with us in the studio Ms. Hussah Alobaid, a senior diabetes educator, to provide us with the right answers about today's topic. Welcome to Medical Talk.
Thank you so much. Thank you for having me today.
Thank you so much. We have so many questions. It's a quite broad topic, but I would like to start with like a very simple, basic definition about what is type 1 diabetes mellitus.
Okay. So before diving into diabetes, I would like to break down some terms to the audience. So just in case if I come across these terms, so they will understand what I'm saying. First is the hypoglycemia and hyperglycemia. So basically, hypoglycemia is a low blood sugar levels, and hyperglycemia is high blood sugar levels. So hypo is low and hyper is high. The glucose is, I want to talk about glucose as well, and the insulin. So what is the glucose? The glucose is basically a sugar, which is the fuel of our body. The body needs glucose for producing energy, and insulin is produced as a hormone that is already exists in our body and is released in response to food to stabilize the blood glucose levels in its normal levels. So this is basically glucose and insulin. And type 1 diabetes, first imagine that insulin is a person who's carrying a key, unlocking cells to allow glucose to be absorbed inside the cell and producing energy for the body. Without that person with the key, so there will be a glucose accumulating in the bloodstream, causing hyperglycemia or high blood sugar levels, and the body will be without energy, and the person will feel fatigued, exhausted, and the body will search for another source of energy, and which might cause serious complications related to diabetes. Now, type 1 diabetes is when the cells that are responsible for producing insulin in our pancreas is damaged completely, and leading to a complete lack of insulin, causing serious complications, as I said before, and this is mainly type 1 diabetes. It's an autoimmune disease that is the immune system attacks the cells that are
These are the beta cells, right?
The beta cells, yeah. Exactly.
Okay. All right. So that's a very wonderful breakdown of the process, basically. It's very important that we lay the foundation to understand how diabetes in general has been affected, whether it's hyper or hypo. But I want to ask you about the difference between type 1 and there is also type 2 diabetes.
Yes. So as I mentioned before, type 1 diabetes is a complete lack of insulin. So the person who's with type 1 diabetes definitely need an external use of insulin, which are the insulin injections, and this is essential for survival. Regarding type 2 diabetes is mainly an insulin resistance with or without the deficiency of insulin. So the cells in the body will become irresponsive to insulin, causing it also to be accumulated in the bloodstream over and over, like accumulating more and more, and then causing a hyperglycemia state. And this is type 2 diabetes mainly. And insulin resistance is mainly, sometimes it will be inherited or genetic, or the person is overweight, especially in the abdominal area.
Exactly. So it's something has to do like outside the cells, basically,
Yeah,
the receptors.
Yes, there is insulin, and the key is there to open the cells, but the cell itself is irresponsive to insulin.
I get it.
Yeah.
So now, back to type 1 diabetes. What can actually cause type 1 diabetes?
The studies are still not conclusive regarding type 1 diabetes. There is no exact cause why the immune system is acting like that, attacks the beta cells in the pancreas, but definitely there are assumptions, and there are several factors that contribute to the occurrence of type 1 diabetes. One of them is the genetic factor. Some people are they are genetically susceptible to type 1 diabetes. Some studies said that there is a specific genes related to a specific antigen system contribute to the occurrence of diabetes, and there is an environmental factors can trigger only the genetically susceptible patient or genetically susceptible individuals. So the main thing is the genetic factors. Environmental factors includes viral infections, geographic factors, and dietary factors as well. Viral infections, they said that there is, the study said that there is some viruses mimic or look like beta cells. So the immune system will attack that virus and the beta cells all together until the beta cells are completely damaged. So this is regarding the viral infections. Regarding the geographic factors, some studies found that the regions which have low exposure to the sun have an increased incidence rate of type 1 diabetes, suggesting that vitamin D deficiency might contribute to type 1 diabetes. And there is also a family factor or family history. If there is a first degree relative parents or siblings with type 1 diabetes, actually these are the factors that are.
Exactly. So I want to go back to the vitamins part. This has something to do with the diet. Could that be also considered one of the risk factors? I mean, you mentioned these are factors, but what are the other risk factors for type 1 diabetes?
Risk factors?
In terms like, for example, diet? Because we know like type 2, it has mainly,
yes.
you know...
Actually, there's type 1 diabetes cannot be caused by specific diet. Like if the child is eating too much sweets, or it's nothing to do with that. They might have later on type 2 diabetes, but never type 1. It's an autoimmune disease, type 1 diabetes, and it has no cause. But some studies suggesting that early introduction to cow milk and other things like cow milk might contribute to the type 1 diabetes, but in genetically susceptible persons again.
So it's mainly genetics, basically.
Yes, exactly.
All right, we got more questions to ask, dear viewers. We have more questions for our guest today, but let's take a quick break. We'll be right back. Welcome back to the studio. We're still talking to Ms. Hussah Alobaid. Ms. Hussah, before the break, we were talking about the high blood sugar, which is called the hyperglycemia. Could you explain to us what are the signs and symptoms of hyperglycemia?
Okay, so the patients mainly can experience fatigue, exhaustion, tiredness, and excessive thirst, recurrent hunger, frequent urination, and also sometimes for serious hypoglycemia might feel abdominal pain as well.
Exactly, but it's not as serious as hypoglycemia. Hypoglycemia is a very dangerous thing, which is low blood sugar. We're going to talk about that as well. But I'm going to talk to you about the complication of type 1 diabetes. Specifically, I want to ask about the process of ketoacidosis. Could you explain that to our viewers?
So, ketoacidosis or DKA is one of the most serious and life-threatening complications of diabetes. Starting with hyperglycemia, as I said before, then if it's the hyperglycemia is not treated promptly, it will lead to DKA. So DKA basically is when the blood sugar is high and there is no insulin to utilize this glucose for energy, the body will start breaking down fats as an alternative source of energy for the body. So breaking down fats through chemical reactions leads to the release of ketones. The ketones are the substances which are toxic and acidic and can cause serious complications such as coma if it's not treated promptly. This is basically the DKA. And the causes for that, basically, if the patient missed or take an inadequate dose of insulin, this might lead also to DKA.
A high dose or a low dose, you mean?
No, if they take low dose
of
insulin and they eat more than the dose, this will cause also. And one of the most important causes is lipohypertrophy. This term means the accumulation of fat under the skin of the injection site. So poor injection technique is one of the causes as well.
Okay, so the patient is not benefiting basically from the injection, assuming that they got the injection right. But
yes, they said we are taking our insulin and everything is fine, but still high, still the ketones are positive. So the main reason it could be the lipohypertrophy.
Excellent. So now I want to talk to you about sick days management. So, you know, when patients come to you and they have this question, how do they deal with it?
Okay, so I would like to talk more about DKA just to make it clear to the audience. The symptoms, as I said, in the hyperglycemia, there is tiredness, fatigue, and excessive thirst, and frequent urination. In addition to these symptoms, there is an abdominal pain, shortness of breath, fruity breath, nausea and vomiting. These extra symptoms related to DKA. So this is how the parents basically discover or how this is how type 1 diabetes diagnosed in the first place. They are taking their child to the hospital thinking that he got a food poisoning, for example, saying that he's got an abdominal pain and vomiting. And upon examination, they found that the blood sugar is high and the ketones also is positive, and they perform more tests, then find then type 1 diabetes is diagnosed. And regarding the prevention or the treatment, DKA can be treated at home if the trace is low, but mostly in the hospital by fluid and electrolyte replacement, insulin therapy, and also continuous monitoring, of course. So the prevention for the DKA could be frequent monitoring of and early catching of the signs, so they can treat it promptly before the DKAs come. Before the DKA is established, and that's it. And for the sick days management, the sick days management now, there is a specific kind of infection might cause hypoglycemia. So this is hypoglycemia can be treated with sugar drinks or white sugar, but mostly the infections cause hyperglycemia and can lead to DKA later on. So it is important to in the sick days management that we we take the right steps to prevent DKA. Sometimes they need to increase the insulin dose by 10 to 20% of the total daily dose. Even if the child is not eating, the blood glucose levels will still be fluctuating, and this leads also to DKA. So we need to take the correction dose of insulin, the dose of insulin. If the ketones are positive, we need to increase the correction dose by around 50%. So let's say the dose is 4 units, they should take 6 units to correct that glucose levels. These basically the sick days management.
But if I'm hearing you correctly, this is also it sounds to me it's a two-way relationship between the patient or the parents
Yes.
and the healthcare physicians to understand how to manage this this situation basically.
Exactly.
In your opinion, what's the most common diabetes misconceptions?
Okay, so there are many misconceptions now in the social media about diabetes, like type 1 or type 2 diabetes. But I would like to come across that type 1 diabetes is for kids only, or occur in childhood. Actually, it's more common in childhood, but it can affect any age. As I said before, it is an autoimmune disease, and if the person is genetically susceptible, they can be affected by type 1 diabetes.
Even at a later age?
Yes.
Okay.
Even athlete. It's more common in
children,
but it can affect any age. Yes.
Okay, so that's one of the misconceptions. That it's just a type 1 is just for one children. Basically.
Yes. Another misconception is hyperglycemia is safer than hypoglycemia. Yes, hypoglycemia is a serious complication, like acute complication of diabetes. But once it's treated, it's gone. But hyperglycemia, if I'm happy with the hyperglycemia, because also the symptoms of hyperglycemia is not that bad or tolerable, let's say. So they prefer to be in hyperglycemic state, but the hyperglycemia over time might cause serious complications affecting the other organ of the body, kidneys, eyes, and all the organs in our body affected by high blood glucose levels. Another misconception here is I eat chocolate to treat hypoglycemia. It's definitely wrong. Chocolate is high in fat, which delay the recovery of hypoglycemia. So the best is half cup of juice or a tablespoon of white sugar or any 15 gram of fast-acting carbohydrates.
Can they have sugar melt with water, for example?
Yes, definitely, but a large, like tablespoon, dissolved in water, or sometimes they have it with a tea. But we need this 15 gram of sugar.
Okay, not the chocolate.
Not chocolate, definitely.
Okay, because the absorption of the sugars may be more efficient with that.
Yes,
right.
Exactly.
Any other misconceptions, or is it more to?
Yes, some people said that fruit juice is healthy and it's healthier than the soda drink. Yes, soda drink is not healthy and it's bad for our body. But in terms of sugar quantities, they are exactly the same, and it will raise the blood sugar the same. The juice and the soda is exactly the same. But we recommend that they have whole fruit to benefit from the fiber and nutrients that are in the fruit instead of having a fruit juice. Definitely.
Exactly. We still got more to talk about, but we have to take a short break. We'll be right back. Do stay with us.
Okay.
Welcome back. We're still talking in the studio to Ms. Hussah Alobaid. Ms. Hussah, before the break, we were talking about type 1 diabetes and type 2 and the signs and the symptoms and how to manage it in a certain way. But I want to ask you specifically, how do we come up with a diagnosis, a definitive diagnosis to type 1 diabetes? Is there like any x-rays or ultrasounds that they could do, or is it something just has to do with a blood test?
Just a blood test.
Just a simple blood test?
Yes.
Okay.
Yes, but exactly the C-peptide and the anti-GAD, they are specific to know the type 1 diabetes. And also I want to tell you about another kind of diabetes. It's very important, and we are seeing it here in this man. It's a type 1.5. It's called 1.5. And now it's called LADA.
Okay.
LADA stands for latent autoimmune diabetes for adults. So LADA starts as type 2 diabetes, and it's diagnosed as type 2 diabetes. The person might need an glucose lowering agents, an oral glucose lowering agents, and then over time we observe that the blood glucose levels are deteriorating even with the medicines. Then the healthcare provider might consider the C-peptide test and the anti-GAD, and they will find the same finding as type 1 diabetes, but it has a slower progression than type 1. Start at type 2 and then slower till type 1.
So they start with type 2?
Yes.
And then they develop slowly to type 1?
Exactly.
Okay.
And then insulin therapy is considered exactly similar to those with type 1 diabetes.
And it's called 1.5? Type 1.5?
The medical term is LADA, but most people, they call it 1.5.
Because so it's in between one.
Yes, the features of both.
Very interesting. Yes. I want to ask you about the insulin role in the managing of type 1 diabetes.
Okay, so it is, as I said before, it is very crucial for survival. Without insulin, we don't ever consider any other medication other than insulin. Later on, if the patient build up some insulin resistance, we can consider metformin or any other medication that might help in insulin resistance. But mainly, the insulin is crucial for survival. And there is a two kind of insulin, the slow release insulin, or the slow insulin, as we say, and another one is the fast acting insulin, which is taken exactly or right before the meal, depending on the meal. So some patients, they are educated on carb counting, so they know that they are eating this number of grams of carbs, so I have to take this units of insulin. But before, it was fixed doses for each meal, like breakfast, lunch, and dinner. The slow acting, it's taken once a day, and it's act 24 hours, stabling the glucose in the normal level during fasting and during sleep as well.
Exactly, it's quite challenging for a child to deal with that, but I guess the parents need to be educated.
Exactly, and that's why we have some courses, and also the educational clinic is open for them. Whenever they need an appointment, they can book an appointment, and we can sit with them separately and educate them. And we keep emphasizing in each visit, we emphasize on the importance of insulin, the importance of injecting insulin right, and the importance of monitoring. Monitoring is very important to indicate, to catch up the symptoms of hypo or hyperglycemia before any complications arise. And also the importance of diet, that now we are not, before they said we don't give them sweets, and for example in Gurgian, or they don't eat with their friends or with their families. This is totally wrong. We don't have to be harsh on them, on the kids. So they need to be with the family. They need to eat sweets and candies in these occasions, but we have to inject more insulin for that.
Exactly. So we need to balance things, and they need to live their life. Kids, they need to live their life. That leads me to my next question. Is what's challenging is for, unlike type 2 diabetes, when we encourage exercising and modifying their lifestyle, for type 1 diabetes, physical activity is quite a serious note that they need to consider carefully.
Yes, exactly. Let's say, for example, in schools, in the PE session, for example, if the blood sugar is high, then they need to a specific number. They need to take a correction dose, and they can go with their colleagues normally. And if it's at a certain number, like 15 and above, no, they need to stay in the clinic with the nurse and get the correction dose and rest. So this is how we deal with that. But if they are well educated, what's the thing that can deteriorate their condition, or they will know what to do exactly. I will inject insulin if it's high. If it's in normal, like around 4 normal range, they have to take a small snack, and they will be preventing hypoglycemia too.
Exactly. Well, we all do thank you and appreciate all the wonderful work you guys doing here at the Desmond Diabetes Institute, and hopefully our viewers will benefit from all the information that you shared with us. Thank you for your time, and hopefully be able to host you again with us in the future.
Thank you so much.
Thank you very much. Dear viewers, we still have more to go. We'll be right back. Stay with us. And now, dear viewers, one of the dynamic departments of Desmond Diabetes Institute is the nutrition department. In today's episode, they will share with us special recipes for diabetes patients and also people who are keen on having healthy nutrition lifestyle. So let's watch it together.
This is Noura, a dietitian from Desmond Diabetes Institute. Cutting back salt from your diet can help lower blood pressure, also known as hypertension. However, most of the sodium comes from packaged and processed foods. The American Heart Association recommends no more than 2,300 milligrams of sodium per day. Ideally, for an adult, no more than 1,500 milligrams per day, especially patients with hypertension. Many of us do not know that sodium can be hidden in many foods, and when a reduction of sodium is recommended, it does not only mean reducing the amount of salt used while eating and cooking. Here are some tips that could help you reduce the amount of sodium in your diet significantly. Number 1, eat outside less. Eating less at restaurants is recommended because you cannot always control the amount of salt added while preparing your meal. And you do not know if the restaurant is using packaged or processed foods in the recipe. If you use canned beans and vegetables, make sure that you wash them under running water before consuming them. Or use fresh and frozen vegetables instead. Tip number 3, eat less packaged and processed food, such as biscuits, cereal, and many kinds of cake. Just because something tastes sweet, it doesn't mean that it is not high in sodium content. While shopping, choose the low salt or lower salt version of your favorite product, such as soy sauce. Number 5, try to remove the salt shaker from your table. Add seasonings and lemon juice to your food instead of using salt and sauces. Finally, get comfortable with reading food labels and ingredients while shopping, and look out for the hidden names of salts in the packaged food, such as MSG, Himalayan pink salt, sea salt, and rock salt. I hope you find this helpful, and thank you for watching.
Well, that's it for our show today. Hope you enjoyed it. Until we see you again, please stay safe and stay healthy.